situation of the respiratory diseases in the region, maybe.
Yeah, thanks, Christian. So zooming out a little bit, just to add a little bit more context, and to say, you know, we're supporting to get more laboratory diagnostics in to support the country as well. But of course, these viruses are circulating. Respiratory viruses are circulating. COVID is not gone. It's not in the news anymore, but it is circulating. We are seeing increasing trends around the world for COVID circulation, but very few countries are actually reporting now. Flu is circulating as well. And if you have conditions where people are living in these horrible conditions, you have underlying conditions, you have malnutrition, you have starvation, outcomes are going to be worse. Rick outlined all of the diseases that are circulating there that are killing people, that are harming people. And of course, respiratory pathogens are there as well. So we will work and continue to support, and Nabil is sitting over here as well, to make sure that we provide additional diagnostic resources there. But of course, there are many, many immediate needs of the people of Gaza. But just wanted to contextualize this to state that these viruses are circulating around, and it's likely to be something that is common. But of course, we will continue to work with the country to make sure that we identify. Thank you.
Thank you very much, both, and thank you very much all. We've come to the end of our press briefing, and I thank you for your participation, especially also Professor Goina, the chair of the MPOX Emergency Committee. We'll be sending the audio files and Dr. Tedros' remarks soon after this briefing. And then for any follow-up questions, please come to us at mediainquiries@who.int. Now, let me see. Let me give to Dr. or Professor Goina if he wants to add a few closing remarks from his side.
Yeah, thank you very much. I think just to say, I appreciate once again the WHO DG and his team for the work that's been done. As everybody has emphasized, we have competing health challenges across the globe, MPOX being one of them. And it's very important that we work collaboratively and collectively to ensure we address our public health challenges, including the challenge of MPOX. Thank you very much for the opportunity.
Thank you very much, Professor. And before we give now to Dr. Tedros for the closing remarks, let me ask our Director of Communications, Gabi Stern, to share a summary of her last years with us here. Thank you very much.
Thank you, Christian. Thank you, Dr. Tedros. Thanks to everyone for what you said about me today. And it really should be said about the communications staff at WHO. In countries, regions, here at headquarters, but also our brilliant technical colleagues who have done massive communications over the years, including during the COVID pandemic, which obviously was a historic and also terribly difficult period for the world. I just wanted to say thanks to reporters online. I was one of you for many decades. In many ways, I'm still one of you. I think once you're a journalist, you're always a journalist. And I thank you for your coverage of all the health issues of WHO. And I encourage you to continue being fierce and telling the truth. We need you more than ever. So thank you, and back to you, Christian.
Thank you very much, Gabi. Now, over to Dr. Tedros.
Thank you, Gabi. Again, all the very best. You're an amazing human being, and we will miss you. But once WHO, always WHO. That you should know. Then to the members of press, thank you for joining us today, and see you next time.
Recording stopped.